Hello, I'm Dr. Jeff Dolgus from Buffalo TMJ, and today I want to talk about some of the muscles in the front of the neck that could get really tight in patients who have TMJ problems and airway problems. So when I'm doing an exam on a new patient, one of the things I'll often feel for, or I'll always feel for, is tightness right under here, under the front part of the chin. The anterior digastric muscles are two of the muscles that are responsible for opening the jaw and pulling the jaw back. And when the muscles that close the jaw or pull the jaw forward are constantly tight, these muscles that do the opposite thing have to also get a little bit tighter in order to keep everything in balance, in order to keep your head balanced on top of your spine. So while it's helpful to do range of motion exercises with the jaw, opening and closing, moving side to side, and moving forward and back, it doesn't do as much good as it could do if you also stretch the muscles in the front and on the sides of the neck. So I'm going to show you 3 exercises to do in order to release some of the tension from a lot of these muscles that run along through this area. Now before you do these stretches, I want to make sure that you understand that I'm going to be asking you to move your neck. So if you've already got problems with your neck, if you've had previous surgery or injuries to your cervical spine, I would caution you to consult with a physical therapist or a chiropractor before engaging in any of these exercises. So you can see on this model right here that we've got springs in the front of the neck here that are attached to the jaw and to the hyoid bone, and from the hyoid bone down to the sternum. And this muscle here represents the sternocleidomastoid muscle that goes from the mastoid process down to the sternum and the collarbone. So these muscles in the front of the neck connecting 1, 2, 3, 4 bones together, all of which move around in the front of the neck, those muscles have to dynamically stay in balance with the muscles represented by these strings in the back of the neck, which are your superior cervical muscles, your paraspinal muscles, which help to keep the head balanced on the neck from the backside. So the muscles in the front have to constantly be balanced with the muscles in the back of the neck so that our head doesn't flop back and forth like a big orange on a little toothpick.
I'm not kidding, it's like an orange on a toothpick.
You're gonna give the boy a complex.
Well, that's a huge noggin.
So the first stretch I'm going to have you do is just look straight looking up. And we're going to try to stretch the muscles that come right down the front of the neck. So what you're going to do is you're going to look up and kind of make a pouty face, like you're pushing your chin or your lower lip up toward the sky. And feel a stretch right through here. And make sure you breathe as you're doing this. So as you stretch, breathe in. And as it releases, breathe out. And as you breathe out, breathe in through your nose and then out through your mouth, you'll find that your jaw will tend to move forward a little bit as you do that exhalation. So do that 3 times. Stretching right through this area. Now you might find that there are other regions that also feel stretched when you do this, and you want to be kind of gentle with it. You don't want to push through to the level of pain. You just want to get to the level where it feels like the muscles are being stretched, and then allow that tissue to release. Not just the muscle tissue, but the fascial tissue that lays over the top of the muscles between the musculature and the skin. Now the second stretch I'm going to have you do is going to target more the anterior triangle here where the scalene muscles are, which are muscles that tend to assist, that help us breathe in the upper region. So if we're breathing up high, when we're really anxious and nervous, those muscles can become really active and very tight. So one of the ways that you can stretch those muscles is by moving your chin away from your shoulders, similar to how you would do the SCM stretch, which is the next muscle we'll get into. But you're going to go mostly up and over, and you're going to try to target right through here, right through where you would feel your pulse in your neck, that carotid artery. So you want to do the same thing with your chin a little forward and stretch here. Now I like to use my hand when I'm doing these stretches because it gives me the sensation of being able to target, being able to feel where I want to release, where I want to stretch. Now when you do these things, you need to hold those stretches, hold that elongation of the muscle for several seconds, maybe a 5 count or up to a 10 count. And breathe. Make sure you breathe as you're doing this. So in through your nose and out through your mouth as you stretch and release the tension in these muscles. Now the third variation on these stretches is going to target more of the sternocleidomastoid, which comes along obliquely along the side of the neck here. And this is the muscle that postures the head forward and turns the head from side to side. So the best way I've found to be able to target that muscle is moving my chin and my shoulder far apart and visualizing these two things moving away from one another. So I'm looking kind of up and back and sort of pulling down a little bit on my shoulder in the opposite direction. And if you feel comfortable with this, turn and move your neck around as you're in that stretch to really feel like you're able to target where these muscles feel tight. Now, after you do this a few times, you should feel like your neck is a little more limber, and you should feel like it's a little easier for you to move your jaw around. I hope you found this information helpful, and if you'd like to see more videos like this, please hit like and subscribe, and don't forget to share with your friends. My name is Dr. Jeff Dolgus, and I thank you for watching.